Treatment for eczema falls into three main types, and you'll often use them together. The first, very importantly, is avoiding triggers and irritants to your skin. The second is moisturising, a lot of moisturising. And the third is steroids, usually in cream form, to reduce inflammation. So triggers, well, the skin hates anything that's too hot, too cold, too wet, too dry, or too windy. So important, I'm afraid, to try and avoid all of those. Irritants include all sorts of things: soaps, perfumes, possibly detergents, even fabric conditioner. It's important to put your child in cotton clothes if possible, especially next to their skin, to reduce sweating, and to hoover really, really carefully, possibly get rid of carpets and have wet dusting surfaces, because house dust mites may play a part. Now, in terms of triggers, this is a really difficult one to stop, but ideally do try and encourage your child not to scratch, because it can make things worse. Emollients or moisturisers are doing two things. Firstly, they are replacing lost fluid, and secondly, they're acting as a barrier to the skin to prevent more fluid from being lost. So you want to put them on really regularly. They usually only last for a few hours. You can use soap substitutes rather than using soap when you get into the bath or shower, because that will reduce the drying effect of water. Steroid creams are often used for flare-ups, and although if they're used appropriately they're pretty safe, you do want to use the smallest dose you can over the smallest area you can for the shortest time you can, so you don't use them once any flare has settled down. You would always use them in conjunction with moisturisers, although you wouldn't apply them at exactly the same time. They usually are safe because the dose involved is very small. Sometimes with eczema you can get a sudden really nasty flare with red, angry, sometimes weeping skin. That may be an infection, and that's where the last bit of treatment comes in, which is antibiotics, but that's just for infected eczema.